Welcome back to The Time of Your Life. I'm your host, Ethel Rasmussen. Brain Matters is the focus of today's show. Our next guest, Dr. Daniel Storch, will discuss what you need to know about brain health. Welcome to the show.
Thank you very much.
As you know, the Department of Aging's initiative for 2016 is Brain Matters. Let's begin by discussing some of the natural changes that occur in the brain with the aging process.
Sure. Aging generally implies a decrease in structure and some decrease in function and reserve. For the brain, this means the brain actually does get smaller. It loses mass, loses volume. The space between the brain, the ventricles get larger, and you can see this on MRI and CAT scans. Also, there's an accumulation of the damages that can occur through the years. So, for example, hypertension can cause even microscopic changes that can accumulate. So a theme that I'd like to state is that it's important to try to keep your brain as healthy as you can, and you do that by keeping your body as healthy as you can.
Okay, what, if any, does the aging process affect mental function of an individual?
Okay, well, there's good and there's bad. Some of the good is that some of what's called like crystallized intelligence is sort of can stay steady. So things like fund of information can even increase. Other things like vocabulary and word knowledge can stay the same. But there's also the negative, that the more active reasoning can decline some. And particularly speed declines, that doing time tasks take a big hit. And also other things like it can take longer to learn things. You can teach an old dog new tricks, but it can take longer and you may need more effort. You can have more distractibility. It may be harder to do things when there's other things going on. It may be harder to multitask. But getting back to some of the good things again, you get wisdom and experience. So sometimes younger folks can come to a decision quicker, but it can be wrong. As an older person, we've been through a lot, we know how things go, and we can sometimes get to a better decision.
What are some of the factors that play a role in sustaining good brain health?
Well, the brain does interact with the rest of the body. So again, the theme is trying to keep yourself healthy is very important. For example, I said the brain declines, gets smaller with age. So does the heart, and the vessels can narrow so you get less blood to the brain. And the brain requires more oxygen than any other organ in the body. So the lungs can decline, so you get less oxygen to the brain again, so it's important not to do any more harm. So if you smoke, it's very important to stop smoking. That's the single most important thing we can do for our health is to stop smoking. In the same way, the liver does decline maybe 30%, so it's important not to damage it further by drinking too much. The kidneys can decline 1% to 2% a year. So again, it's important not to make this worse. Diabetes can affect the kidney. And if you're overweight, it can lead to diabetes and again affect the kidneys. So you want to try to keep yourself healthy as possible. And besides the brain and the body interacting together, the body and the brain interacts with the outside world. So you want to stay active, socialize. Generally, people who socialize and have friendship groups do better than people who don't.
We've all heard the phrase, use it or lose it, in regard to memory function. Can you give us some advice as how our viewers can sustain their brain function?
Well, it's very important to stay mentally alert. I was talking with somebody at a senior center a couple of days ago who plays bridge. That's a good way to keep mentally alert. Other things, crossword puzzles. My mother used to do word jumbles, so that's important. But again, I'll get back to trying to keep the brain healthy. You keep the body healthy. Things like exercise is so important. We used to think you can't make new brain cells, but exercise can actually stimulate the brain to make more brain cells through this brain-derived neurotrophic factor. Diet is so important. More and more we're talking about Mediterranean diets, more vegetarian diets, fruits, vegetables, olive oil, less red meat, less fried foods, less processed foods. And again, staying active is important. And having good socialization is important, trying to decrease stress, accentuating the positive, trying to stay away from the negative, getting enough sleep. Again, stop smoking if you smoke, and limit alcohol.
Can you talk about some of the diseases of the brain that are associated with the aging process and when our viewers should talk to a physician?
When we talk about brain diseases in old age, often we talk about problems with memory, attention, concentration, the general term that we call dementias. And maybe about 3 to 5% of 65-year-olds have dementia, increases to maybe 40 to 45% in 80-year-old people. But again, it's important to know that most seniors don't have dementia. But of the dementias, the most common is Alzheimer's disease. So there's dementias, then Alzheimer's is the most common. About 2/3 of dementias are Alzheimer's, but there's a lot of other kinds as well. It's important to be diagnosed early, not only for planning, but some dementias, a few of them, can be reversed, like those due to thyroid problems or B12 deficiency. So it's important to get diagnosed early. Other conditions, delirium is described as a fluctuation of alertness and consciousness. Someone sort of seems out of it. And we see a lot of this in the hospital. It can be caused by simple things like urinary tract infections and constipation. And if you treat this, the person can get back to baseline. Again, we talked about the general medical illnesses, problems with the liver and the heart and the lungs. And if you treat these things too, that helps the brain. And then emotional problems are so very important. That I've often said that getting old is not for sissies, that there's lots of anxiety about your health, your people you love's health, money, will you have enough money for retirement? And every senior I've met has also lost someone that is dear to them. You don't get older without losing someone. So issues of loss and grief and depression also play a role. Now, concerning a doctor, I feel that everyone, especially seniors, should have a primary doctor. And the idea of this is the primary doctor is sort of like the hub of the wheel, and that the person gets to know you and what your baseline is, and then can refer you when needed to the different specialties. So concerning the doctor, I think it's important that you have a doctor and he and she gets to know you, so then you can go from there.
Do you have any last remarks that you would like to pass along in regard to this topic to our viewers?
Well, what I hear from seniors over and over again is staying busy doing something you enjoy. And then again, I would just repeat the basic healthy lifestyle things: exercise, diet, activity. Baltimore County has 20 good senior centers and going there. So, and stop smoking, limit alcohol, and have a primary doctor.
Thank you, Doctor, for being with us to share this valuable information in support of our initiative.
My pleasure. Thank you.
We're going to take a short break. When we return, learn about Senior Center travel, senior box office, and what's happening at your local senior center.